So let's start with the Klebsiella family, and the tribe Klebsiella is going to include a lot of things, but the most important one for us are Klebsiella and Serratia. Now, when I'm talking about Klebsiella, there are different types of this Klebsiella, which is the most famous one that is known as Klebsiella pneumoniae or the Friedlander's bacillus. Friedlander's bacillus. In fact, if you say Klebsiella pneumoniae, it has many subtypes going forward. It has a subtype called as pneumonia itself, Ozynae, and Rhinoscleromatis. So Klebsiella pneumoniae, Klebsiella pneumonia Ozynae, Klebsiella pneumoniae, Rhinoscleromatis. So when I say Klebsiella pneumoniae, that is the one which is obviously going to cause pneumonia. There's no doubt about it. So first let me tell you what all does this Klebsiella pneumoniae cause. It causes pneumonia, which can be community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia. So CAP, HAP, VAP. Community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia. Also, this can cause exacerbations in COPD patients. This can cause CAUTI. What is CAUTI? Catheter associated UTI. And it can cause septicemia. So primarily, of course, it's pneumonia, but it can cause a lot of other things also associated with it. That was Klebsiella pneumoniae, pneumonia of Friedlander's bacillus. Now we come to Klebsiella ozynae, and ozynae, for obvious reasons, is going to cause a disease called ozynae only, and ozynae is nothing but atrophic rhinitis. That is what is going to happen in ozynae. And this is very, very interesting because in this, the patient has a foul smelling discharge, which means that a person around him or her will be able to smell that discharge, but this patient himself or herself has anosmia. Anosmia means that the patient will not have any smell ability, but imagine this is known as merciful anosmia, which means that himself or herself, he can't smell anything, but everyone around him is getting a very bad smell. That is what is Klebsiella ozynae. Next, what we have is Klebsiella rhinoscleromatis, which obviously causes rhinoscleroma. And rhinoscleroma is something which is associated with three very important pictures. So what is the gross finding and what is the microscopic finding of rhinoscleroma? We'll see that with the help of a diagram. So look at this, guys. This is Klebsiella rhinoscleromatis or rhinoscleroma. Please, in the exam when you go, don't confuse this with something else that is known as rhinosporidiosis. Rhinosporidiosis was totally different. I had studied that under the fungus wala chapter, totally different. Here I'm talking about rhinoscleroma, and that shows you this kind of a nose. Can you see? Initially there's a woody nose, so that is how you describe it. It's woody, but after some time the entire nasal cartilage, it goes back, the soft palate, everything is destroyed. So you can call it a woody nose, or you can also call it the Hebra nose. That is rhino. Rhino will anyway tell you that wood hai na, matlab nose hai. So woody nose or Hebra nose is there. What do you see microscopically? We see something called miculic cells. So if you look at the first picture over here, all these foamy cells. All these foamy, what are these? Macrophages which have eaten up the organism. So these foamy cells are referred to as the miculic cells. And if you look carefully, dekho, it's a bacteria. It is going to result in antibody production. Antibody production means these pink color bodies that you're getting. Immunoglobulin, that is Russell body. Where in pathology do you study Russell body? Antibody disorder, multiple myeloma also shows you. So coming all the way back, now I think you all know that grossly it is going to show you either you call it a woody nose or you call it a Hebra nose. And next, microscopically, it shows you two things. One cell, which is very, very famous, is going to be the miculic cell, and the other one is going to be the Russell bodies. Now, this was about Klebsiella pneumoniae and its subtypes. We have something called Klebsiella granulomatis, which is very important because this causes something called genital ulcers. And those genital ulcers are painless. Now we started on that journey. We are going to do a lot of genital ulcers on the way. I'll keep telling you which are painful, painless. For the time being, please remember Klebsiella. So repeating once again, I am saying for the time being, Klebsiella granulomatis. So dekho, Klebsiella, and we are saying granulomatis. So this is how I have learnt it. That G will remind me that it is going to be a genital ulcer, and I have already told you that illa means no. So there is going to be no pain in this genital ulcer. That is Klebsiella granulomatis, also known as also known as donovenosis. Donovenosis means that this is going to show you the donovan bodies. What are donovan bodies? So you can very well see over here that there is a big cell which we call as the Punt cell. Punt cell is nothing but a macrophage. There will always be a foodie macrophage which has eaten up everything, isn't it? So there's a really big cell which is said to be a macrophage, and that macrophage has these organisms which are showing you the very, very famous safety pin appearance. Guys, I'm going to give you a list in a while. Safety pin appearance basically means that there is bipolar staining that is present. Whenever we say safety pin appearance, in simple words, that means that there is a bipolar staining that is noted over there. So this is just one of the organisms. Klebsiella granulomatis, I'll repeat it. Klebsiella, illa means no pain. G, granulomatis means genital ulcers, also known as donovenosis. So it is going to show you the donovan bodies. What are the donovan bodies? The donovan bodies are nothing but this Punt cells, and what are inside these Punt cells? These Punt cells contain the famous safety pin appearance. So this wraps up definitely this entire thing for all of us, and we can move forward. So recently there is a strain which is known as the hyperviscous and hypervirulent. So HVKP means what? HV means hyperviscous, and virulent, another V means hypervirulent strain which has come up of Klebsiella pneumoniae, so known as HVKP, hyperviscous, hypervirulent strain of Klebsiella pneumoniae. And that is, of course, the name is only telling you that it is very, very virulent. So it is going to cause a lot of things. It's going to cause not only community-acquired pneumonia, but also meningitis, also sepsis, and all the more it's virulent. It's very resistant to treatment. So just another new strain, hyperviscous, hypervirulent, very, very virulent, very, very resistant. Now let's come back, guys, and talk about the different, what did I say? Hyperviscous. You will say, ma'am, if you're saying hyperviscous, is it viscous in general? Exactly. That is what I want to come down to next. What exactly is its morphology and its testings? So please note that K for Klebsiella, and you need to know that Klebsiella K wala sound na. So this means it is a capsulated organism. Yes, Klebsiella, Ella tells you it is not motile, Ella is no motility. And Klebsiella tells you it is a capsule made up of mucopolysaccharides. So now, because of that capsule, is there something that you're going to find out? Let's see. So tell me, on a MacConkey agar, is it a lactose fermenter? Yes, E. coli, Klebsiella, they are lactose fermenters. But did you also notice that MacConkey mein what color do we get for lactose fermentation? You get a pretty pink color. So now if I ask you, E. coli is also going to be a lactose fermenter and is going to give you a pink color. And Klebsiella is also a lactose fermenter and is going to give you a pink color. How will you differentiate? So you will say Klebsiella has a capsule. Anything that has a capsule will not only give you a pink colony, but will also give you a mucoid colony, not just a pink colony, also a mucoid colony. So have a look at this. These are your MacConkey agar. Of course, it has come out to be pink. Anything pink definitely tells me that it is definitely a lactose fermentation. But look at the shine on its surface. It's very, very shiny. It's mucoid. Similarly, look at the shine over here. And if you see, not only is it mucoid, so the shine is telling me it's mucoid, but if you try to pick it up, can you see with the loop it's showing you a string, right? So this is going to show you the stringy appearance, which is very, very important. So please note, not only is it mucoid, but they have started calling it the string test. It also shows you string test positivity. Talking about its enzymatic activity, let me know. There are very few. Let me tell you, just Proteus and Klebsiella. I'll give you a mnemonic in the end. These are urease positive organisms. So can you tell me all the urease positive organisms for urease? You are going to first get a punch, and after that you're going to get a kiss. Okay, so what is happening in urease? You are going to get a punch, and followed by a punch, you will get a kiss. So the mnemonic for urease is punch kiss. What is punch kiss? Let's get going. P for, like I told you, Proteus. The Proteus ends with us, so urease. Then U for urea plasma, common sense. N for nocardia. C for cryptococcus, again has urease, US in the end. Then we have H for Helicobacter, Helicobacter pylori. All of us know for Helicobacter pylori in the stomach we have that urea breath test and all. Hai na? Then we have the one that we are doing, Klebsiella, and then we have these two staph, Staph saprophyticus and Staph epidermidis. What family were they belonging to? They were coagulase negative staph. Hai na? So repeating, guys, what is punch kiss? Let's do a repeat. P for Proteus, because it has a US in the end. Urea plasma anyway has urea in its name. Nocardia. Cryptococcus, US in the end. Helicobacter everyone knows. Klebsiella, and the Corns wala staph epidermidis and saprophyticus, these are all the urease positive organisms. So yes, Klebsiella is definitely going to be urease positive. What about its IMVIC testing? This I've already told you, minus, minus, plus, plus. Because now again, if you have to differentiate between E. coli versus Klebsiella, I have told you the IMVIC testing. E. coli was plus, plus, minus, minus, and Klebsiella was minus, minus, plus, plus. Finally, coming to the fermentation, it ferments all the sugars with acid and gas. So all of these biochemical reactions are sorted. So simple. अगर ऐसा stringy test दिया, that is Klebsiella. अगर ऐसा pink color का test दिया, that is going to be urease positive. So you are punch kiss, and of course whether you get a punch, you're going to have a red cheek, pink cheek, or if you get a kiss, then also you're going to blush by being red. So red or pink, so urease is going to give you a pink color. So pink color ka hi colonies on lactose, pink color ka hi urease positivity is what you get. What is the treatment? They are not very easy to treat because we have a lot of XDR strains, drug resistance that is there. But yes, for even because of that, we use advanced antibiotics like piperacillin and tazobactam. We can even fight those XDR strains with colistin and polymyxin and others, but they are very expensive. So all in all, I realize you have to rely on the antibiotic sensitivity testing. If I want to summarize this entire Klebsiella, first I can say Klebsiella K for it had a capsule. Then I told you that it is also going to be lactose fermenter, and it's going to have a very important enzyme called urease. And I told you lactose fermentation on MacConkey gives you pink color, and urease test is also going to give you a pink color. Remember, punch and kiss, whether you get a punch you turn pink, whether you get a kiss you turn pink. So both of them are going to give you a pink color. Then finally I told you have illa. Illa will tell you that, oh, it is not motile. This is a non-motile organism. Just a quick summary. This was tribe Klebsiella because other than Klebsiella, it also had Serratia marcescens in it. Serratia, what is this? Some red color is gonna come out. So before I go to that, please remember Serratia will always enter into your surgical side things like IV cannulas, surgical instruments, antiseptic solutions. तो जितने भी surgical instruments हैं या फिर antiseptic solutions हैं या contaminated IV lines हैं, into that Serratia is gonna go. What all does it cause? Wherever it will go na, as I told you, a red color will come. So if it causes pneumonia, what is it gonna cause? Pseudohemoptysis. Pseudohemoptysis means the person will have cough, and along with that the person will have sputum, and the sputum will have a red color. So as soon as someone starts spitting out red color sputum, you say, "Arey, he's having hemoptysis." But is this person having bleeding? No. This person is having Serratia infection. So that red color is nothing but the pigment of Serratia. It is a false hemoptysis. Similarly, he can have eye involvement. That is going to be contact lens keratitis. Again, red pink color aana chahiye. That is known as the pink hypopyon. So there's a pink hypopyon again because of Serratia pink color. Similarly, meningitis, they can have cardiac involvement, septicemia, all other organs are possible. But having pseudohemoptysis and pink hypopyon, pink, red color is important, and that is how the slide is going to be. What color pigment does it have? It has a red color pigment at room temperature. What did I say? Now you can write Serratia easily for all of you. What is Serratia, guys? S is going to be, it is going to cause many of the surgical site contaminations. That could include IV cannulas, solutions, surgical instruments. Then it is going to produce a red color pigment which is going to be at room temperature. And where do you see the red color pigment? Only where the organism is. Has the entire slide become red? No. So what kind of a pigment is it? It is a non-diffusible pigment known as protogeosin. So jo pseudohemoptysis karayega, that is going to be a protogeosin. So remember, this red color pigment is referred to as protogeosin, and it is responsible for all pink color things. That is pseudohemoptysis, pink hypopyon. These are the things that you should be knowing. Quick revision: Serratia for surgical site, red color pigment called protogeosin, which is going to be produced at room temperature. It is non-diffusible. Let me remind you, you did a pigment for Staphylococcus aureus. What color was it? Staphylococcus aureus, AU for golden. That was a golden color pigment. Now you're doing a pigment for Serratia. What color is it? RR. It is going to be a red color pigment, and in both of these you studied the same thing. It is going to be non-diffusible. It's not going to diffuse out because shortly you will do a pigment which will diffuse out. Okay, so this is done with the tribe Klebsiella. What do we move on to next? We now go on and start our story of the tribe Proteae. And I told you Protea is going to be ppm, means it's of course going to have Proteus, but it's also going to have Providentia and Morganella. Did I just tell you the punch kiss mnemonic in which I told you that all of them, that Proteus wala is urease positive? So Proteus to hai, Morganella is also there. This Providentia is not. So Providentia is not urease positive. Proteus and Morganella is going to be urease positive. But one thing which everyone is positive is the phenyl pyruvic acid testing. Phenyl pyruvic acid testing, if you can learn this just by not being very, very inquisitive, I will be very happy about it. But if you are one of those who have a lot of curiosity and want to know what is phenyl pyruvic acid, although I feel when it comes to micro and a half, your curiosity kind of goes away. But still, phenyl pyruvic acid testing means that you are going to form phenyl pyruvic acid from what? Phenylalanine. So how is phenylalanine converted to phenyl pyruvic acid? This means the bacteria have an enzyme, phenylalanine deaminase. Yes, there's basically an enzyme that is present called phenylalanine deaminase, which will convert the phenylalanine to phenyl pyruvic acid. Again, as I said, keep it simple. All of them are going to produce phenyl pyruvic acid. All of them are PPA positive. So remember, ppm is PPA positive. Proteus, Providentia, Morganella. ppm is PPA positive. Proteus and Morganella are also urease positive. Providentia is urease negative. Of course, my primary concern is going to be Proteus. And do you know what is the meaning of the word Proteus? Proteus refers to Greek god. Greek word here, which means it can take any shape. It is a pleomorphic bacillus. And I have already told you we are studying the gram-negative bacilli. This also doesn't have a capsule, but this has a very, very, very important motility. Rather than motility, I try to call it growth, and that is the swarming growth or swarming motility. Please note, this concentric round and round and round thing that you are seeing on a blood agar, that is swarming. So this level of concentric growth cycles, that is referred to as swarming. And let me tell you once again, guys, that this is not just seen with Proteus, it is seen with PVCs. What is PVCs? So first, of course, you have Proteus, but in a while, you will be studying something called Vibrio parahemolyticus. You will be studying something called Vibrio parahemolyticus. Also another Vibrio that is known as alginolyticus. That is exactly the next chapter that you have. So basically not Vibrio cholera, not cholera, but Vibrio parahemolyticus and alginolyticus. Then I have already taught you Clostridium tetani. And Clostridium matlab spore forming. Is there any bacillus? With a C, yes, bacillus C wala matlab cereus. Bacillus cereus also shows it. And finally, there is one thing that we just now studied, Serratia. So Serratia also shows you swarming, which means I will finally go back and complete my mnemonic. Serratia shows you swarming, surgical site infections, red color pigment, room temperature. So sounding well? So SSRR for Serratia. Coming back, who all shows you swarming? Proteus, Vibrio parahemolyticus and alginolyticus, Clostridium tetani and cereus, and Serratia. So now swarming kisme dikhega? All that PVCs to you have done. But you don't want swarming. You say, ma'am, I want to see a plain growth. I don't want to see the round and round thing. How do I stop the swarming? First, use a very firm agar. Imagine if I make your surroundings very tight. I close the doors, the windows, and I put a rope around you, tie you up in a rope. Will you be able to move? No. This means a firm agar, firm for 5 to 6% ka agar kar do. If you have read in your culture media chapter, normal concentration of agar is somewhere between a 2%. I am now making it very, very tight, very firm. How will the bacteria move? So this means swarming will be inhibited. If I add some chemicals, like I add some chloral hydrate, some boric acid, chemicals are always toxic. They will not let anyone move. And thirdly, MacConkey agar inhibits swarming. Okay, that is news, guys. What was the, come on, tell me, what was the composition of MacConkey agar? It's a pretty pink plant. T, taurocolate. Taurocolate matlab bile salts. Bile salts are damn toxic. So that means all of these features are then going to inhibit swarming. So what are the three methods of inhibiting swarming? Either you make a firm, very tight agar, 5%, firm 5, or you use MacConkey because MacConkey has bile salts which are toxic, or you add some chemicals like boric acid, chloral hydrate, they are also toxic. Now you see that is there any use of this swarming in terms of epidemiological typing? So for example, there are 5-6 patients in the ward who have ended up having Proteus. Now you want to find out that are all these 5 patients in my ward having the same Proteus? Is this something which is like spreading in this ward? Is this one type of Proteus only spreading, or are they all genuinely having individual Proteus infections? So if you want to know that are you dealing with the same strains of Proteus, or are you dealing with different strains of Proteus, what are you going to do? You'll take this blood agar, you will put one strain over here and one strain over here, right? Both the strains you have kept. Now this will also start swarming from here. This will also start swarming from here. Right now you don't know whether they are from the same family or not. One Proteus here, one Proteus here, they start swarming. So now tell me, if you, and two scenarios, if you have a meeting fixed with your best friend versus you have a meeting fixed with your enemy, whom are you going to go and hug as soon as you meet? Whom will you be very, very happy to meet? Obviously your best friend. So if you and your best friend will meet, you will hug each other, you will fuse into each other. But if you and your enemy will meet, you will come to each other but say hello and go away, है ना? You are not going to hug each other. So simple. Same hai, best friends hai, their swarming will merge, but if they are different, they will separate. So this means that in same strains the swarming is going to merge. Whereas if they are different, then you will see a line of demarcation. They will maintain their distance because they are enemies. So yahan pe what happened, as I saw over here, I could appreciate when I zoom in that this was swarming from here and this was also swarming from here, but somewhere when they got close to each other, they decided that nahi, I don't think we are the same people. We have to kind of be a little separate. There is a tiny little separation that you see in between them. Matlab there is a line of demarcation. This means they were different strains. Simple. If they are same best friends, their swarming will merge. If they are different enemies, there will be a line of demarcation. Is there any other? So this will help me knowing that are all the people in the ward having the same Proteus, or is it different? It's for epidemiological typing, and this is known as the Dines phenomenon. So what is this Dines phenomenon? Dines phenomenon means that you are testing for this epidemiological typing. Also another thing that you have to know is that do not confuse it with something known as a Dines stain. Guys, for what do you do a Dines stain? Dines stain is something which is done for mycoplasma, which we'll study right in the end in the miscellaneous chapter. That is Dines stain for mycoplasma. So tell me, other than this, is there any other use of Proteus that we have? Yes, I'm going to take up the non-motile strains of Proteus. If I take the non-motile strains of Proteus, especially Proteus mirabilis, and I use the OX2, OX19 and OXK, I'm not using it for Proteus. I'm taking this from Proteus, and you know what am I using it for? I'm using it for the Weil-Felix test in Rickettsia. So in Rickettsia, you do a test called the Weil-Felix test, in which you actually pick up what? You take the strains of Proteus, OX2, 19 and OXK. We will study about this test in Rickettsia, so I just wanted to mention it. Finally, what do you do in the treatment? Highly resistant. So you have to definitely known for its resistance. You have to go for antibiotic sensitivity testing. Ampicillin and cephalosporins are usually used in the treatment. So if I can give you a very quick recap, Proteus, did I tell you all these members are PPA? The PPM are Proteus phenylpyruvic acid testing positive. Have I told you another thing with P, that is it is a Dines phenomena positive? Have I told you that this is going to be an enzyme called US, that is urease positive? Did we study S for it shows you swarming motility? And now I can tell you that whenever they ask you what is the odor, this tends to give a fishy, dirty odor. So these are the points of Proteus: PPA test positive and Dines phenomena. Then you have the odor, which is very, very fishy. Then you have the Proteus, us for urease positive and S for swarming. I'm just giving you these small mnemonics because I know in the last days you will not be able to study everything. So you can skip through these. Acha, Klebsiella ka name Klebsiella, Proteus ka name Proteus. That is what it's going to help you a lot in. So we were doing which family? Tribe Proteae. Proteae is done. Providentia, you don't have to know. Morganella, you have to know. So out of Proteae, Providentia, Morganella, I just want you to learn M for Morganella, M for Machi. Okay, that is how I have learned it. M for Morganella, M for Machi, because this is associated with food poisoning of uncooked fish. So this is known as the scromboid food poisoning. This is known as the scromboid food poisoning. So simple as that, you have to know Morganella matlab Machi wala food poisoning. Machi wala food poisoning, fish. Okay, so this is also done. There's another tribe that we have which has only one organism, and that is the tribe Erwinia. And what is the organism that it's going to have? It's going to have the Erwinia herbicola. Erwinia herbicola. So please note, this is the one that causes UTI and it is associated with a yellow color pigment. So remember, Erwinia is going to have yellow UTI, and there is nothing else about it that you have to know. So simply the tribe Erwinia is also done. Now we come to the next one, and that is going to be Yersinia. That is the next organism under Enterobacteriaceae, but there's a catch over here. I know whenever I say Yersinia, all of you are only thinking of Yersinia pestis, plague. No, that's not the right way of approaching it. Yes, you are thinking of Yersinia pestis, which causes plague, but do you know Yersinia pestis doesn't come under this Enterobacteriaceae family? I am just reading it over here for completion, but ideally Yersinia pestis is causing plague, but doesn't come under the Enterobacteriaceae family. It's a miscellaneous bacteria. What comes under the Enterobacteriaceae family is known as Yersiniosis. These are Yersinia enterocolitica and Yersinia pseudotuberculosis. So you will say fine. The tribe Yersinia has Yersinia pestis, Yersinia enterocolitica and Yersinia pseudotuberculosis, out of which pestis causes plague but is not a part of this family. Enterocolitica, pseudotuberculosis, together known as Yersiniosis, are a part of this family. So if I have to do their differences, first thing that I will do is their ability to produce urease. So remember, these Yersinias of mine, which are Yersiniosis, produce urease. So remember the years, although it's not very important, that's why I did not put it much in the punch kiss mnemonic. But over here you need to know Yersiniosis is going to cause ureases. Okay, that is how I have learned it. Yersiniosis wala organisms are going to produce ureases. After that, please note, we have to talk about their motility. So the Yersinia pestis though is non-motile. So neither is it showing motility nor is it showing urease. But this Yersinia enterocolitica and pseudotuberculosis, they are, and they have a little weird thing. See, they are motile at what? They are motile at 22 degree. At 22 degree, they are motile, but they are not motile at 37 degrees centigrade. What is this kind of motility known as? This is referred to as the differential motility. And now can you recall for me, if I have to make a table over here, the differential motility in which you were seeing that you can see motility at 22-25 degrees centigrade, but you don't see motility at 35 or 37 degrees centigrade. So did I tell you there is one organism which is tully all the time, drunk organism, keeps tumbling and falling? Listeria. We had studied that Listeria is also tully and tumbling, and that tully and tumbling organism could drink in his 20s but could not drink in his 30s because of age. That is how we had learnt it. Can drink in the 20s but cannot drink in the 30s. Same way, Yersiniosis is also like that. Can have motility, roam around in 20s but cannot roam around in the 30s. So remember, these are the two organisms which are known to cause this. Yersiniosis and Listeria show differential motility. Now, obviously, for the time being, first I'll quickly finish off these two Yersiniosis, that is Yersinia enterocolitica and pseudotuberculosis. If you see, they are associated with everything to do with GI tract. So there is gastroenteritis, there is mesenteric lymph node involvement, there can be terminal ileitis. In fact, it can many a times mimic appendicitis because it comes to you with pain in that region. Pain in the appendix region is going to mimic appendicitis. So many a times this is also known as pseudoappendicitis. Please note, Yersiniosis is many times known as pseudoappendicitis. So basically I realized primary condition is going to be the GI tract, gastroenteritis, mesenteric lymph node involvement, ileum involvement, appendix involvement, and in adults it can also cause some other organ involvements, right? So now we come down to how are you going to do the diagnosis of this Yersiniosis. Means I'm talking about Yersinia enterocolitica, Yersinia pseudotuberculosis. I'm not focusing on Yersinia pestis for the time being. So remember, there is going to be a McConkey agar, and I had studied that Yersinia and all of them are non-lactose fermenters, but this Yersinia enterocolitica can sometimes show lactose fermentation. Next, what is the mobility? This I've already done. It can move around in its 20 to 25 degree, but it cannot move at the 37 degree. This information I have already done. Same goes for its temperature. This follows something called cold enrichment. What is cold enrichment? That ideally it will grow somewhere around 25 degrees. But if you incubate it at a very cold temperature, it will get enriched. It will start growing easier. The same phenomena was also seen in Listeria. So now you can see that there are a lot of similarities that you have between Listeria, or I will write it listeriosis, and yersiniosis. Okay, that becomes rhyming for us. Listeriosis and yersiniosis, both of them show you a phenomena that is known as cold enrichment, and both of them are going to show you a phenomena known as differential motility. Means they can move in the 20s, they cannot move in the 30s, right? And cold enrichment means that at cold temperature of 4 degrees, they are going to be grown easier, they are going to be isolated easier, so they are coldly enriched. This is the main point, even important for yersiniosis. And now I can also finish off Yersinia pestis telling you Yersinia pestis does not belong to the Enterobacteriaceae family. For completion, I'm taking it up over here. And Yersinia pestis is the one that is going to cause plague. So what are the 4 endemic foci for plague? Tamil Nadu, Maharashtra, Himachal and Uttaranchal. So if you're from any of these places, just for your general knowledge, I'm telling you now that they're going to ask. So now my concern is that how does plague happen? I mean, what are the vector and organism and all? Then what are the virulence factors? What is going to be the signs and symptoms? The diagnosis, the treatment, the vaccine, as usual. So first let me start off with what kind of an organism or what kind of a disease is plague. It's a zoonotic disease. Zoonotic means it's coming from the animals to the humans. Okay, so who is the reservoir? We know this is rat wala disease, and rats, say who brings it to us? Of course, that is going to be Xenopsilla, means we have rat flea. So there is going to be a rat, and via a rat flea, it is going to be coming into us. So that is Xenopsilla, Cheopsis or Astia. Different species are in North India, South India, right? So how does it spread? I hope you know it is basically by the bite of a rat flea. I'll tell you the entire organism's life cycle, how the rat flea is going to take it from the rat and how it's going to give it to the humans. But in PSM, you do the rat flea index. What is rat flea index? So you're being territorial, that how many fleas are present for how many rats. So number of fleas divided by the number of rats, that is going to be the flea index. So if you want to find out the flea index, keep flea in the numerator, number of fleas divided by number of rats. So simple, the reservoir is the rat, from there the vector is a rat flea, and it's going to come and give it to humans, so it becomes a zoonotic disease. So what is going to be the entire life cycle? Firstly, we say that okay, there is a rat that is in this story. So the rat flea is going to first go and bite this. So it is going to get infected from the rat. It's going to take the infection from the rat. What will happen? In the stomach of this rat flea, now there is going to be a multiplication. The plague is going to multiply. That is why we call it what? Go to your parasitology lectures. I have taught you that the type of vectors are propagative vectors. So this happens to be a propagative vector. Propagative means that this is propagative. We had studied that, see, vectors are 2 things. Either the organism is going to develop in them, or the organism is going to multiply in them. So propagative are those PR in which there is going to be replication. So can I say rat flea is a kind of a propagative kind of a vector in which there will be multiple, I can see multiple plague organisms formed. And now what do? This was happening in the stomach. From the stomach, you can't go and infect someone. So it will come back and block this salivary gland area. In the flea, I am becoming a flea for the time being. So for the time being, all this organism is multiplying in my stomach, and after some time, it's going to come back and block the proventriculus of the flea, so that next time when it bites, it's going to spit out everything. Next time when it bites, it's going to regurgitate everything in the blood meal. So imagine, from the time it took it from the rat, number 1, to the time the proventriculus is blocked, that is the extrinsic incubation period, which is approximately 2 weeks. Repeating once again. From the time, and I'm going to repeat this entire cycle once again for all of you to be very clear. What happens? Firstly, there is a rat, and that rat, from this rat, the rat flea has taken this entire bacteria. It has gone into the stomach, and in the stomach it has multiplied. So it is a propagative vector. After that, it is going to come and block the proventriculus. So from the infection to blocking of the proventriculus, it is going to be the extrinsic incubation period, means not in humans, bahar wala incubation period. And finally, when it's going to take a blood meal in the humans, it's going to come and give it. So it is zoonotic infection. There are lots of virulence factors. If you're one of the inquisitive ones and you can learn so much, please do. But what you have to learn, that is, there is an envelope antigen called F1, because later on the vaccines are also made out of it. In fact, they say over here it's nicely written as a protein envelope antigen. This is also known as a protein capsule. This is also known as a protein capsule, and that is a difference, because I have always learned that capsules are made up of polysaccharide, and now I am reading over here that capsule can also be made up of protein. Yeah, this is not very commonly known by students. So please note that protein wala capsule is the F1 capsule, and protein hai, so it is plasmid coded and it is heat labile. I will be using this in the vaccine in a while. Other than that, it has VW antigens, coagulase, fibrinolysins, it has toxins. Again, as I said, this is there in every bacteria. If you can learn it, the enzymes, the toxins, very good. But F1 protein capsule or envelope, you have to know. So now tell me, if there is an animal involved, there is a flea involved, and there is a human involved. So what are the cycles of plague that we have? One is an urban cycle. Urban cycle means that this is going to happen between the rodents and the humans. Whereas there is a wild sylvatic cycle. So देखो, जो urban वाला है means where people are living, domestic cycle. So we are humans and there are rats and the cycle is happening between us. But if it is a wild or a sylvatic, this is only between the wild rodents. In this, there is no human involved. So two cycles. One is urban between human and rodents. One is wildlife cycle, that is between rodent and rodent. And what are the types of plague that you have? Bubonic plague. Why did I count like this? Bubonic has 7 alphabets. So the incubation period is roughly going to be 2 to 7 days. If it enters septicemic, anything can enter septicemia, that will also have 2 to 7 days. However, if it has a respiratory involvement, that is going to happen very quickly in 1 to 3 days. So repeating, the bubonic 7 alphabets, there's going to be 7 days. Respiratory wala plague, very, very quick. And anything going to septicemia, again 7 days. So what is the bubonic plague? The bubonic plague basically means that there is a painful lymph, bubos, means bubos is always lymph node. Painful lymph node is bubos, and fever to of course hoga. Pneumonia, guys, come on, pneumonia we know is going to be respiratory symptoms, and this is associated with a bioterrorism agent. Coming to septicemia. Septicemia means ultimately even bubonic plague can go to septicemia, pneumonic plague can go to septicemia. Septicemia means the patient is going to have sepsis. Also, this is known as black death. Why is it called black death? Because patient can have sepsis, shock, DIC. There can be multiple organ failures. DIC with shock, with multiple organ failure. That is why, guys, plague is also known as black death. Hai na? So repeating, there's a bubonic plague in which there are painful buboes or lymph nodes. Pneumonic plague, which is of course respiratory. Anything can go into septicemic plague, that is black death. Bubonic and septicemic 7 days, pneumonic is 1 to 3 days. So how do you do the diagnosis? Firstly, what sample will you take up? Depend. If it is a bubonic plague, you will take sample from the buboes, means you're going to take the bubo sample. If it is a respiratory symptom, then you will take sputum. If it is some other multi-organ involvement, you will take as per that. So you will take the, the final sample depending on the site. And what does it show you? Once again, it shows you the famous safety pin appearance. Yes, microscopically, you see the safety pin appearance. Another name for safety pin appearance, I told you, it looks like this. This means it is a bipolar staining. Safety pin appearance refers to bipolar staining, and I've got you all the organisms in microbiology that show you that. So for that, all of you will have to make a safety pin, and I have no mnemonic because I think by now you are sick of mnemonics. Our ABCD has also stopped working. Hai na? So now how will you learn it? So let me see. From one end of the safety pin, can I make a Y? Yes, Yersinia pestis. Can I also from the bottom make a V? So that is going to be Vibrio parahemolyticus. Okay. From here, can I end up making a D? So Haemophilus ducrei. From the D, can I make a B? All the Burkholderia malai, Burkholderia pseudomallei. And finally, we have that I can dissect it and make a K. And that K means Klebsiella granulomatis. Remember I told you the Donovan bodies a while ago? Exactly. So do you want to do this? A lot of drawing that I've done. So pehle in the exam, make a safety pin. If you make a V out of it, it is Vibrio parahemolyticus. If you make a Y out of it, it is Yersinia pestis or plague. If you make a D out of it, Haemophilus ducrei. You make a B out of it, Burkholderia malai, pseudomallei. And you make a K out of it, Klebsiella granulomatus. Bus fill all the lines, practice this once on your own and you are sorted. These all show you the safety pin appearance, but now the question comes is, what is the stain used for knowing this safety pin appearance? Most importantly is the Vasen or the new methylene blue, also the Wright or the Giemsa stain. If you have to mark one, you have to mark the new methylene blue or the Vasen stain. So remember, Vasen or new methylene blue, also Wright and Giemsa can be used. What else? What are you going to use for the culture? So let me show you two pictures. Firstly, you can see that there is something known as the CIN agar. And it's a long name. Please don't get into it. Don't even Google it. It's so confusing, so lengthy. You don't have to know. For Yersinia pestis, you have the CIN agar, and that is going to show you the very famous bullseye colonies. You can see the bullseye beautifully over here. Apart from that, you can also see the ghee broth. There is something known as a ghee broth, and from top of the ghee broth, do you see something is falling down? So that is referred to as the stalactile growth. So remember, selective media was CIN agar, that is going to show you the bullseye colony. Whereas if they ask you what is the ghee broth, that is going to show you the stalactile growth. Stalactile growth means something is hanging, dropping from the surface. So stalactile growth and bullseye, repeating those, this is referred to as the stalactile growth. It is hanging from the top, and bullseye of course looks like a bullseye. These are the two main things. After that, you can definitely know the others. Like any other thing, you can grow it at a culture of 27 degrees. 37 पे it might develop an envelope. Everything I'm realizing, it is very comfortably, whether it was yersiniosis also, 20s mein everything is going fine. 30s mein jaake it has developed an envelope. Okay. On blood agar or chocolate agar, this can give you a dark brown color colony because of the absorption of hemin. So I realized that Yersinia pestis is not only going to be a black death, means plague, it is also going to show you a black blood agar. The black blood, so black death may be bloody death ho raha tha, and black blood agar or brown blood agar is also noted. But these two, please don't forget, it shows you the stalactile growth and it shows you the bullseye. So how I have learnt it is, for example, this is because of rats na. If you want to kill a rat, thoda sa imagination, I tried searching for pictures, I couldn't get. If you want to kill a rat, what are you going to do? You have those rat traps na. So how do they show you in the cartoons? How have they killed the rat? They pick a rat with the tail. They always pick a rat with the tail like this, and they show you that the rat has been hanging rat. So stalactile, something hanging. They always show you a hanging rat, and if they want to catch the rat, they put a cheese or something. That's how they show you for mice and all. So they put a cheese or Tom and Jerry wala, and they trap it, matlab bullseye. Bullseye for catching the rat, and hanging rat, that is, I've caught it, stalactile growth. So stalactile growth and bullseye is for the rat wala disease, and that is going to be your Yersinia pestis. The diagnosis is not over as yet. You've only done the culture. What about the biochemical reaction? So we have realized that the glucose, mannitol, maltose, basically the sugars are going to be fermented only with acid production. No gas production. Catalase positivity, yes. Oxidase negativity, but that is for everyone in this family, na? Enterobacteriaceae, catalase positive, oxidase negative. You will tell me IMVIC testing. Is pure mein IMVIC is important. So tell me something, guys. I gave you a mnemonic called I am shy, and I am shy said that when you are talking about Shigella and when you are talking about Yersinia, you are gonna be interested only in the methyl red test. So minus plus, minus minus. Only the methyl red testing is there in Shigella and Yersinia. So I am shy. So how are you going to do the serology? Now go back, think, what was the antigen? Ma'am was focusing a lot on the F1 antigen. So against the F1 antigen, if I get antibodies at a titer of more than 1:128, that is definitely going to be very important. So repeating, antibody against F1 and more than 1:128, that is the significant titer. And what about rats? So please remember, if you have rats, first and foremost, before you start isolating this organism from the rats, make sure you dip it in 3% Lysol so that all the infected flea and everything has been, destroyed. So whenever you're dealing with any animal study for plague, always dip it in 3% Lysol. Okay. Now finally, vaccine. Abhi bhi common sense hai that the vaccine had to be prepared from. So there is a recombinant F1V vaccine. Vaccine is also prepared from F1 antigen. There is something known as the Soki's vaccine. Now please remember, Soki's vaccine is going to be 1, 2, 3, 4, 5. It provides the protection for 6 months, or you can learn it as Socrates also. That will make it better. So if you learn the Socrates vaccine 1, 2, 3, 4, 5, 6, 7, तो 6 और 7 months तक का protection है, and the protection is only against those 7 alphabet वाला bubonic. The protection is only against the 7 alphabets wala bubonic plague. It is a formalin-killed vaccine. So, Socrates modification of Hafkeen vaccine. Remember, Socrates modification of the Hafkeen's vaccine is Socrates 7 alphabet, protection against bubonic plague 7 alphabets, protection approximately for 6 to 7 months. But if you ask me what is the treatment is going to be streptomycin. This treatment is going to be streptomycin, and if there is involvement of brain, or there is involvement of lungs, or there is involvement of heart, then you can add the fluoroquinolones. So you can add the fluoroquinolones if there is involvement of systemic organs. On that note, we are now going to move on. Yersiniosis is done, Yersinia pestis is done. Now starting with the last part of this particular chapter, and that is the Salmonella. Once we are done with this, we are going to make an entire master chart regarding motility, lactose fermentation, urease and IMVIC testings. So that's also going to come up. Let's finish off the last organism, that is Salmonella. Salmonella is of two types. We have typhoidal and non-typhoidal Salmonella. And for this, again, I'm going to show you a classification because fancy names are important, but please don't learn it. There's something called a Kaufman and White scheme, which you just know is used for Salmonella, but please do not get into that rat race of learning which is A, B, C1, C2, D2. That is not at all needed. You should know, yeah, there is Salmonella typhi, there is something called paratyphi, A, B, C, all that is okay, but you don't need to know this. You just need to know Kaufman and White scheme is for Salmonella. So before I begin, I can definitely see that there are some antigens that I need to play around, and I have tried to make those antigens into a little bit of a flow chart for all of you so that it's easier. So please note, there is something called an O antigen, which is somatic. Everyone knows that's in the what? That's in the cell wall, na? So that is going to be heat stable. And then there is an H antigen. We all know from general H antigen is flagella. There is also known as a VI antigen, and these are both heat labile. So learn any one, that the somatic antigen is heat stable and the flagellar and the VI antigen are going to be heat labile, and these antigens are a complex, little bit of lipid, little bit of polysaccharide, little bit of protein. So it's going to be all of it a complex. And remember, the somatic antigen is also known as the bovine antigen. Some of you will be very simple, sorted in life. You'll say, we just want to learn it. Some of you would want to know the meaning of bovine antigen. So it is basically extracted by using an acid called trichloroacetic acid. My advice, don't learn it. So it's a complex and it is also known as bovine antigen. That is the somatic antigen. If you have learned this, now I can tell you the different properties. Out of them, please note that ये जो VI antigen है, this is the one that I am going to use for VI for vaccination. The main काम की बात is this. It's the one that I'm going to use for making a vaccine. But what actually happens is that it covers the O antigen. So for example, if this finger of mine is the O antigen, VI antigen will basically cover it. So tell me, this was an O antigen. If I would have added anti-O, anti-sera, reaction hota. But if it is covered with VI antigen, now if I add anti-sera, will it agglutinate? No, this will not agglutinate. So please remember, the VI is a cover. VI is a cover over the O antigen. So now what are the O and the H antigens? O is somatic, which is in the cell wall. H is flagellar, which is more immunogenic. Which is more immunogenic is going to be H antigen. Very, very immunogenic. It shows a very, very fast reaction. This means that if you will add any antibody, because this is more immunogenic, this shows you a very, very fast reaction and it shows you very fluffy, loose clumps. Whereas somatic wala, S for S, it's going to be a very slow reaction and it shows you chalky granular clumps. So how have I learnt it? Please note that when we are talking about somatic, sote, it will give a reaction. Sote means it's going to have a slow reaction, number one. And because you call it the O antigen, you will see this granularity. You will see chalky granularity. Whereas the H antigen, which is the flagellar antigen, flagella ko split karo, you will get number one, it's going to be a very, very fast reaction and there are going to be loose, fluffy clumps. There are loose, fluffy clumps. So life can become simple if we want it to be. Hai na? So remember, somatic antigen of this will give a sote slow reaction and O antigen hai to ... granularity will be seen. Whereas flagellar, F for fast reaction, L for loose, fluffy. But what's the concept? Why is it giving a fast reaction? Because it's highly immunogenic. You studied the basics, but I told you there is something called Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B. Okay? These are the Salmonella that you have. Remember the O antigen is going to be the game. Means when I say game, I wanted to say that it's everywhere, it's the same. So game khel gaya wo. Game khel gaya means the O antigen says whether it is typhi, paratyphi A, paratyphi B, I'm going to be the same for everything. But the flagellar antigen is the one which is going to help me in differentiating. Means when I say O antigen ke saath reaction hai, you will say, ma'am, it could be for typhi, paratyphi A, paratyphi B. Really doesn't matter. Whereas for flagellar antigen, I will have a separate flagellar antigen for typhi, separate flagellar antigen for paratyphi A, separate flagellar antigen for paratyphi B. And remember this, because these 4 antigens are going to help you very soon in a test called Vidal. So the O antigen, I'll say it's the same for everything, whereas the flagellar antigen is different for everything. And VI antigen, I've already told you I'm going to make a vaccine out of it. Okay, so before I go on to all of those clinical features and all of that, please note that there are some antigenic variations. If O antigen is lost, H antigen is lost, VI antigen is lost, is that known as antigenic variation? So tell me, if the H antigen is lost, ma'am, flagella is lost, this means the flagella is going to be lost. This is very simple to learn. If the O antigen is lost, O antigen is what? O antigen is the somatic antigen. O antigen is the somatic antigen, or you can say it's something to do with it's the cell wall, isn't it? So I am saying that till the time the O antigen was present, everything was going very, very smooth. Now when the O antigen is going to be lost, things are going to become rough. Why? Because there is loss of virulence. So remember, till the time the O antigen was present, life was very, very smooth for the bacteria, because the bacteria had a lot of power. When you have power, life is very smooth. But when that O antigen will go away, the virulence will go away. Then the bacteria will get to know that I have no value. Then life is going to become rough for this bacteria. So remember, smooth is when the antigen and virulence is there. Rough is when the O antigen and virulence is not there. Coming to the last one, the VI antigen, the vaccine wala, that is lost and that changes into W. So VI, if it is lost, that will change into W strain. So nowadays there is a lot of Salmonella which are VW. VW means intermediate forms. Kind of they have lost the VI, kind of they have it. So these are the intermediate forms. ये नहीं भी याद रखो चलेगा. This you have to know that H antigen lost means flagella lost, O antigen lost means virulence is only lost. Life has become rough. Now let's talk about Salmonella typhi, or you know what we're talking about. We're talking about enteric fever. So first we'll talk about the pathogenesis, the clinical signs and symptoms, and then the diagnosis and treatment. So when I say enteric fever, in simple words, you call it typhoid fever, and enteric word definitely tells me that this is to do with the intestine. So what is the pathogenesis? Of course, you know that typhoid kyun hota hai. Put your common sense. Typhoid is because of consumption of contaminated food and water. So fecal-oral route, and the infectivity dose is 10 to the power 3 to 10 to the power 6 bacilli that you need. So it's definitely not small. It's a decent amount of infectivity dose that you definitely need. So what is the cell that is going to enter? So please remember, in the intestine, it's going to enter the M cells. In the intestine, it's going to enter and bind to the M cell. So if I draw this as the Salmonella, it will enter the M cells. From there, it will go into the submucosa. It will go into the submucosa. You will say, okay, ma'am, the submucosa basically has a lot of macrophages and all of that. Will they kill the Salmonella? No. They will resist the killing. Why? Because they have SPI, Salmonella Pathogenicity Island. God has given it a Salmonella Pathogenicity Island, which will make sure that no one can kill it. It can survive, it can spread, it can invade, it can take its wings out. So basically, the strength of a Salmonella is a Salmonella Pathogenicity Island, which will allow it to spread, to invade, not to get killed, for survival. Sabke liye Salmonella Pathogenicity Island, and ultimately from the submucosa, it's gonna go into the lymph nodes. It's going to go into the lymph nodes, and we know that whenever kaun sa lymph node, intestine hai to mesenteric lymph node, right? And we know that if something goes into the lymph nodes and then goes into the lymphatics, it has a probability of going into the blood, and that means that is primary bacteremia. Primary bacteremia means it has come out into the blood, but while roaming around in the blood, where is it going to go to? While roaming around in the blood, it is going to go all the way to the organs, like it can go to the liver and the spleen and other organs, for example. And from those organs, it will again come out into the blood. again come out into the blood. Can I now call it secondary bacteremia? I can call it secondary bacteremia. I've told you the detailed pathogenesis for you to listen to once and then just know that primarily what happened. Question number 1, it went into the M cells. After that, it survived and went to the lymph node. From the lymph node, it has gone into the blood, so primary bacteremia. Then roaming around from the other organs, it again came into the blood, so then that was secondary bacteremia, right? So what are the conditions and what are the, the different features? I think everyone knows there is a very, very famous step ladder pattern fever that you see in enteric fever, that it is going to remain stable and rise, stable and rise. So there is a step ladder pattern fever. I hope you remember in pathology, where did you see step ladder electrophoresis, step ladder DNA pattern, and that was seen in apoptosis. So this is the step ladder apoptosis pattern. This is step ladder fever of typhoid. Okay, what ulcers in the GIT? So if you remember typhoid, I have always told you again I've taught you in pathology, typhoid, is wound longitudinally. So the ulcer that you have is longitudinal ulcers. You end up seeing longitudinal ulcers. What diarrhea? The very famous pea soup diarrhea. They love to destroy these words. Pea soup diarrhea. Now, another thing. Whenever you have fever, you expect that the heart rate will go up, tachycardia. But over here, the heart rate goes down, and that is known as the Fagot's sign. That is referred to as the Fagot's sign. I told you it's going to go to different organs. There's a soft palpable liver and spleen possible. And on the second or the third week, there are rose spots that are seen. And if you put pressure on the rose spots, they are going to fade. They are going to fade when you put pressure on them. So now, out of these, the questions that I expect, fancy names favorite. What fever? Step ladder. What diarrhea? Pea soup diarrhea. What kind of tie longitudinally pehnoge to longitudinal ulcers. Also, whenever you have fever, you expect tachycardia, but here it goes into bradycardia, that is Fagot's sign. Similarly, on a blood test, you will say, ma'am, it is an acute infection. Acute infection, what cell goes up? Neutrophils go up. But remember, in pathology, I taught you this is an exception. Here, the neutrophils are not going to go up. Here, there's going to be relative lymphocytosis. Here, there's going to be relative lymphocytosis that you see. So again, an exception. I was expecting the heart rate to go up, but that went down. I was expecting the neutrophils to go up, but the lymphocytes went up. That is what is typhoid. Now further, you need to know how are the carriers. Everyone's heard of the carrier. There was one carrier who shed typhoid Mary, the cook, the famous cook, typhoid Mary, who cooked in so many houses and spread it to thousands and lakhs of people, because carriers are those who shed the organism in the feces and the urine. So stool or urine carriers, दो type के carriers हैं, stool carriers, urine carriers. That is one differentiation, whether someone is a stool carrier or a urine carrier. Urine carrier matlab it's somewhere in the bladder, and stool carrier is basically the carrier site is gallbladder. So site of carriage. Second is duration. If someone is in the recovery phase and is carrying the organism, that is somewhere between 3 weeks to 3 months, that is the recovery time, that becomes a convalescent carrier. After 3 months till 1 year, that becomes a temporary carrier, and anyone beyond 1 year will become a chronic carrier. So simple, during the recovery phase, 3 weeks to 3 months convalescence, 3 months to 1 year temporary carrier, beyond 1 year is going to be a chronic carrier. So now coming to finally the point, how will you do the diagnosis? And there's a very, very famous mnemonic called BASU. How have we divided BASU? That is depending on which week the patient has come to you. Week 1, 2, 3, 4. So please note, in week 1, you would prefer to do a blood culture. In week 2, you would want to do an antibody test. An antibody test is known as a Vidal test. In week 3, you would want to do a stool culture. And in week 4, you will want to do a urine culture. But guys, this is very, very strict. It's not that 7 days, 14 days, 21, not like that. Yes, there can be an overlap. Antibodies can come in by early days also and can persist longer. Stool culture can come positive earlier also. This is just a way of learning. Blood culture, antibody, that is Vidal. Stool culture, urine culture, week 1, 2, 3, 4. Let's start with blood culture. Lots of blood culture techniques are known. So remember, they take blood and culture fluid in the ratio of 1:10. And this is usually a lot of broths that are there. So bile broth can be taken, glucose broth can be taken. And many people, because they were having diarrhea, so maybe they were having antibiotics. So to remove the antibiotic effect, you might want to add SPS. If you want to learn sodium polyethanol sulfonate, you can, not needed. SPS is added to basically remove antibiotic effect. On the other hand, they are also saying that you can use the Castaneda medium. You can use the Castaneda medium also. That is also important. So please note, these broths and Castaneda media are basically used for the blood culture. Now, first week was blood culture, next week was antibody, which is going to get you the maximum tests. Maximum question comes on Vidal test. That Vidal test is a test for testing the antibodies. And when is it most reliable? In week 2. So it's highly sensitive, agreed, but it is not specific. I'll first give you an example. When the first wave of COVID came and when people started recovering and everyone started making antibodies, we realized suddenly in my lab I was going through the reports of the last, trying to correlate things because COVID tha, we were all trying to do our best and find out something extra out of it. So I saw that suddenly there's a spike of typhoid cases in my lab and I found it very weird that everyone's suffering from COVID, but why are people simultaneously showing me a lot of Vidal tests positive? I realized that Vidal test is a very non-specific test. Any antibody produced for any other disease will give you Vidal test positivity. So because in that time everyone was going through COVID and recovering and having antibodies, that is the reason that those antibodies were cross-reacting and giving me a positivity with Vidal also. So yes, you will see positive, false positives. For example, you can see it with infectious mononucleosis, that has a lot of antibodies. You can see it with malaria. Malaria season mein suddenly you will see the typhoid Vidal is going high. SLE is an autoimmune disorder. It has so many antibodies. Of course, they are also going to cross-react. So the problem is that this is a non-specific test, which means if you do just one test, you can't say, "Arey, patient has typhoid." You will have to do multiple testings. Means you will have to do paired testing. There will have to be a gap of 2 weeks that you will keep between 2 tests, and you will have to see how much increase in the titer. A 4-fold increase in titer. So today, if you've done a test of Vidal and you feel it is positive, after 2 weeks, you should see that the antibody titer has become 4 times. Then you'll say, "Acha, ye genuinely wala typhoid Vidal hai." Or maybe if the titer falls, then maybe it was some other disease that resulted in it. So now, what is the principle of Vidal? Of course, you know that these are the 2 antigens that you have, the O and the H antigen. So I'm going to start off with those. But first, I need to give you the principle. See, there is something known as a slide Vidal and a tube Vidal test that you have. But before I get to that, I need to tell you what is the principle of Vidal. So before I go to slide and tube, my concept is that I have learned up till now that we have an O antigen, and O antigen is played the game. It has said, I'm going to remain same for all, para typhi A, B, C, typhi sabke liye. Whereas, so I can write, just if I write TO, that will mean that this is for typhi, paratyphi, sabke liye. But when I'm talking about the flagellar antigen, that is different for Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B. So how do I write it? If I write TH, this means it's for flagellar antigen of typhi. If I write AH, this means paratyphi A ka flagellar antigen. If I write BH, paratyphi B ka flagellar antigen. Has everyone first and foremost understood the terminology that I will be using? So how many antigens am I testing for? I will have 4 antigens in my lab, and from the patient's blood sample I will find out where is the antibody present. But now you need to learn a mnemonic, that is OH. So this is your next part that you will learn, and there's so much. First I want to put myself safe. Before you guys send me screenshots of different books and QBanks and apps and say, "Ma'am, you taught OH, but over there something else is written," let me tell you beforehand, OH is just a very, very basic way of learning. Most of the cases it is not even followed. But please note, when I'm talking about OH, O antibodies are the ones which they say that are first to appear. Then next to appear in the blood are gonna be the H antibodies. Then the first to disappear from the blood is also going to be the O antibodies, and the last to disappear in the blood is going to be the H antibodies. This is what all the conventional books say, and give it 2 minutes extra, but listen to me so that you don't have confusion with other platforms and other books and MCQs while solving. I'll tell you what to mark also. So please note that all the old wala books say OH. That is, O antibodies will come first, O antibodies will go first. H antibodies will come later, H antibodies will go also later. So OH, come first, then come second, go first, go second. Okay? So now if I tell you these scenarios, abhi I'm not telling you the controversy, I'm telling you the old school method. If I go to this scenario, look at this. The O antigen, same for all. The H antigen of typhi, the H antigen of paratyphi A, H antigen of paratyphi B. Now if I say the reaction has come to O antigen, you will say ma'am typhoid to hai. But whether it is typhi, paratyphi A, paratyphi B, that I don't know. For that I will have to look at this. The flagellar antigen of typhi has come. This means this is a case of Salmonella typhi. Let's look at the next. Over here, O antigen reaction has come, so typhoid to hai. But the H antigen has come for paratyphi A. This means which strain is this? This is paratyphi A. Next, the O antigen reaction has come, typhoid to hai, but this time the flagellar antigen for paratyphi B has come. So the answer is paratyphi B. So I realize the O antigen will to come in all because it's common. Where has the flagellar antigen come? That will give me the diagnosis on whether it is typhi, paratyphi A or paratyphi B. Now comes that OH-OH controversy. If they say that this is an early infection, so if they say only reaction with O is there, and all the others have come out to be negative, then you will say this is an early infection because the first to rise was O, this was an early infection. Whereas they say that now everything is negative, only H, ya to iska H, ya is any one H, either the H of this or this or this, any one H is there, you will say H was basically the one that was the last to leave. We had studied that H will appear second and will go also second. End mein aayega, end mein jayega. So this is going to go in the end. This means I am referring to a late infection. I am referring to a late infection. Okay, coming to the last, if only the O antigen is not there and everything else on this planet is there, means the H antigen of all of them are there, why is O antigen not coming up? Because someone has covered the O antigen, VI has covered. This means the patient has received vaccine. So if vaccine has been received, then the reaction with the O is not gonna occur, but the reaction with all the others is definitely gonna occur. So repeating once again, that if you get only O antigen reaction, this means it's an early test. If you get only H antigen, this means it's a late test. And other than O, if you get all the H's, that means it is going to be a vaccine. Now all is done. This is seeming so simple, but what's the controversy? If I ask you a question, out of O antigen and H antigen, which was the one which was more immunogenic? The one which was more immunogenic was H. You'll say, ma'am, when H is more immunogenic, why are you saying that it will come second in the blood? When it is more immunogenic, which creates a greater response, H should be the first one to come in the blood. Exactly. Now I am contradicting my own statement. If MCQ आया, because this is such a varied test, now you cannot fit it. Something you can't fit into MCQ. Some things are patient related. I can't put them into one option. So I'm telling you what to mark in the exam. I'm telling you what you will see in your clinical practice. Clinical practice में तो OH दिखेगा. OH, and this is how you're going to do the diagnosis. If O is there, early infection. If H is there, it means it's a late infection. You will do OH for your practice. But if MCQ comes and they ask you, which is the first one to appear in the blood, the first to appear and which is going to be more immunogenic, please mark H. Please mark H because the correlation for MCQ is going that way, that H is more immunogenic and that is why it should come first, but that will not help you in your diagnosis. That will not help you in your diagnosis, okay? So diagnosis ke liye practicality OH for solving these questions OH, but what is the titer? So the titer for every state is different because please note that the titer, you must have seen every Vidal report has in the end the titer of 1:to this much is significant. Har state ka alag hai. They go as per the endemicity and the population there, but gradually books say 1:60 for O and 1:180 for H is said to be double almost. 1:60, 1:180 is going to be double, triple for that matter. That is going to be the titer, but this will change and most likely they will give the titer to you in the exam that what do you have to consider significant. So I'll give you an example. This is what a slide Vidal test looks like. Can you see over here? Pehle to NCPC, negative control, positive control. Don't focus on that. Focus on your four main things. This is the O antigen. This is the flagellar H, flagellar of paratyphi A, flagellar of paratyphi B, and I can see that there is an agglutination. This is just a schematic diagram. So I could see an agglutination. I've tried to show you every possible variation that how the agglutination and clumping is gonna come up. But like I said, this is a lot of false positives. So now we have new tests called Typhi dot and dot blot. These are basically card-based tests which can help you in knowing the antibodies. So nowadays what we are doing is gonna be the Typhi dot. So now what are you done? You are done with the blood culture, you're done with antibody. If you have to do stool and urine cultures, what are the culture media? Do I have to teach you this? I told you one story of sisters. The Salmonella and the Shigella sisters is what I had told you about. So tell me guys, what is the enrichment media for Shigella that you studied? Selenite F broth and tetrathionate broth. This you have studied. Then what is it for the selective media that you studied? XLD, DCA, SS and HE. Have we studied? So something with deoxycholate should come. SS मतलब Salmonella Shigella sisters का एक आगार है, and HE is hectin enteric. Enteric word will tell me enteric fever. So this was same for Salmonella and Shigella, but you'll say, ma'am, there has to be a point where you differentiate between them. And this is the recent FMG as well as the NEET PG question, and that is the Wilson and Blair medium. So tell me, who created a fight between these two sisters? There's a boy named Wilson. He came and these two sisters ended up separating. Till now, everything they were together. Wilson and Blair came and created a problem. So remember, Wilson and Blair is something that you will see only for typhi, and typhi is gonna get jet black colonies like you see over here. So please note, Wilson and Blair medium is going to be for Salmonella typhi, and what you're going to get are gonna be the black colonies. Very important. So who created a fight between Salmonella Shigella sisters? It's the Wilson and Blair. Now we come to what is the IMBIC testing. There is minus, plus, minus, plus for Salmonella. How am I going to learn this information? See, for Salmonella, I told you antigens OH. For Salmonella, we did OH. Those antibodies hai, IMBIC is also like that. O ka negative bana do and H ka positive bana do. So what is it? It is minus, plus, minus, plus. Minus, plus, like OH, that is going to be for Salmonella. Let's move on to the next. What are the other tests? I have already told you. Have I told you neutrophils will never increase? There will be relative lymphocytosis. Ho gaya. For the students who are second year students, there is a Phage typing which is done. A and E1 Phage is very important for Salmonella typhi. Ratta question if you can. MCQ skill, it's not important. But Phage typing helps you differentiate different organisms. Finally, coming to the last part of Salmonella typhi, and that is the vaccine. So you all know now we have a live oral vaccine called Typhi Oral. Typhi Oral TY21A. Typhi Oral. If you want to go into the details of this vaccine, please note that T121A is going to lack an enzyme called UDP galactose epimerase. Kya hai ye enzyme? Till the time this enzyme is there, the organism is going to survive. I have removed this enzyme, so when this oral vaccine will be given, within 4 to 5 divisions of the bacteria, this vaccine is going to die off. Basically, the bacteria is going to die off, and that's what is needed. Na? You don't want the illness to occur. You just want 4-5 divisions should occur, immunity should be formed, and the bacteria should die off. So how have you maintained? Otherwise, the bacteria would have kept on multiplying and patient would have had typhoid. So you've kept an enzyme called UDP galactose, that is epimerase present. If you can learn it, UDP galactose epimerase, this is lacking. This has been removed. So when this enzyme will not be there, after 4-5 divisions, the bacteria is going to die off. So that is the live Typhi oral vaccine, Typhi oral. You're going to give it as an oral route. There's also the TY2, that is Typhine VI vaccine, that is TY2 vaccine. VI vaccine hai, so you know that VI antigen has been used in it. Now, what other typhoid species do you know? Just one slide about it. There is something known as Salmonella gastroenteritis. Gastroenteritis. This is a type of a non-typhoidal Salmonella. Remember the first slide I told you, typhoidal and non-typhoidal. Typhoidal wala you've done, typhi, paratyphi A, paratyphi B and all of that. Now we come to non-typhoidal. Salmonella gastroenteritis hoga. So gastroenteritis is one name. So you'll say, ma'am, gastroenteritis is so telling me that it is causing some gastroenteritis like enteric fever. But you said it is not caused by Salmonella typhi. What is it caused by? It is caused by Typhi murium or enteritidis. So remember, gastroenteritis is either caused by Typhi murium or by gastroenteritidis, and of course this is also gonna have a source of food contamination, meat, milk, and a short incubation period of 1 day, right? So this is going to have all kind of fever, vomiting, for that matter, invasive diarrhea can also occur because of this, and the treatment is usually going to be supportive. So repeating once again, when I'm talking about Salmonella gastroenteritis, so gastroenteritis will definitely come to your mind, but please note typhimurium is more common. Iska most important question is typhimurium is more common. Similarly, Salmonella can also cause septicemia, and who is going to cause septicemia? Cholera suis is going to cause septicemia. So Salmonella cholera suis is going to cause septicemia. Septicemia means firstly all organs are affected, whether it is the heart or the lungs or the bones, osteomyelitis, sub effect hoga, and it is going to have a fatal rate. So in the non-typhoidal, there is a gastroenteritis. Repeating, who causes it? Typhimurium, more common than enteritis, and then there is a Salmonella septicemia caused by cholera suis. With that, we have definitely wrapped it up, but this one table is very interesting for me, which I have to pick up because I know students kind of are scared of this the most. I've got you all the members of this family. First, tell me, remember I told you all of them are motile. Which are non-motile? I said illa. Klebsiella, non-motile. Then I said, okay, Shigella, non-motile. Salmonella motile hai, but I told you in Salmonella there is Gallinarum and Pulorum. Salmonella Gallinarum and Salmonella Pulorum, these are the ones that are non-motile. The rare wale Salmonella are non-motile, and Yersinia we had studied, Yersiniosis, Listeriosis, differential motility. May or may not be motile. So basically the illa are going to be non-motile. Salmonella may of course the rare wala. Okay, motility done. Talking about lactose, KK wala sounds for fermenters means E. coli, Klebsiella, Enterobacter, Citrobacter. All the coli, KKK ones were lactose fermenters. So remember, when you're talking about lactose fermenters, E. coli, Klebsiella, Enterobacter, Citrobacter. They are lactose fermenters. All of the others are non-lactose fermenters. Now let's come to urease. Guys, urease, I gave you a mnemonic called punch kiss, which had everything, but the two organisms that it had of this family was P for Proteus and K for Klebsiella. So Klebsiella and Proteus in this family are positive. So urease wala is also done. Remember, urease gives you a pink test. Punch se bhi pink hoge, kiss se bhi pink hoge. So that is going to be urease. Finally comes the IMVIC testing. Firstly, if I differentiate E. coli and Klebsiella. E. coli was plus, minus, Klebsiella was ulta, that was minus, plus. Then if I ask you, there was a mnemonic called I am shy, means Shigella and Yersinia had methyl red positive. Dhundo, Shigella, yes, methyl red positive. Yersinia, yes, methyl red positive. Finally, Salmonella. Salmonella was that Vidal test wala, OH. So I had learned that instead of learning OH, you will learn minus, plus, and that is also done. Others you don't have to learn. Whatever I have told you, only that much information. Repeating once again for all of you. When I talk about E. coli, plus, minus, Klebsiella, minus, plus. I am shy tells me methyl red is in Shigella and Yersinia. So Shigella mein methyl red, Yersinia mein methyl red, and Salmonella mate is going to be OH. OH is going to be minus, plus, and this entire family is over. I know it's lengthy, it's one of the lengthiest gram-negative organisms we have. Other ones are thankfully chota, but I hope you've been able to understand it. Quickly tell me your question. What is the indicator that we used in the CLED media? CLED was that blue color wala media, so the indicator used was bromothymol blue. But what is the indicator that I used in McConkey? McConkey had a mnemonic called plant, and N was for neutral red. Coming to the next question. Okay. CLED media is considered better than McConkey. For which reason? Did I tell you that CLED was more comfortable? It was allowing everyone to grow. So, firstly, does it differentiate lactose from non-lactose? That both of them do, na? That's not a difference. Both of them differentiate. Both of them prevent the swarming. Both of them will inhibit the growth of others, but which is less inhibitory? Who will allow gram-positive organisms to grow? CLED. So that is why it's better. This is a previous year AIMS question. Which organisms causes hemolytic uremic syndrome? If I don't read the options also, there are two organisms, enterohemorrhagic E. coli and Shigella. What do I have? They've not even asked me the details. They've just asked me E. coli over here. So that is very, very simple. Coming on to the next one. Diagnostic test of enteroinvasive E. coli. Invasive, it's going to be the, of course, invasive E. coli, Serine test. That is how we had written it. Serine test is going to be enteroinvasive E. coli. Coming on to the next question. There's a 65-year-old diabetic man who presents to the emergency room with a severe productive cough, having a thick, bloody sputum resembling currant jelly. So remember, when they are talking about a red currant jelly sputum, currant jelly will remind you of Klebsiella. Also, I know Klebsiella is lactose fermenter, so on my concrete shows the pink colonies which are mucoid. Of course, Klebsiella is not only going to be pink colonies, but is also going to be mucoid. So that definitely gives me currant jelly sputum with pink colonies and mucoid. Of course, it is a classical case of Klebsiella. Coming to the next, which of the following shows stacked brick appearance on cell lines? Stacked, aggregate ho gaya. Which one? Entero-aggregative E. coli. Entero-aggregative E. coli. Coming to the last question that we have over here. The blood of the patient was connected or suspected to have pyogenic liver abscess, was sent for culture. The morphology shows large mucoid colonies with a positive string test. Stringy mucoid. Only someone with a capsule can have it. And again, the answer becomes Klebsiella. Yes, that can cause a liver abscess, but that's not the point. It can cause anything in the body, from pneumonia to liver to septicemia, but mucoid and stringy, that is something which is going to give you the hint. And with that, we definitely wrap up this entire section that we have of the Enterobacteriaceae family. It's been a really long journey, I believe, but trust me, I've tried to still make it concise. You open the textbook and it's never ending. We're going to move on to the next chapter now, and that is the Vibrio followed by the non-fermenters.